Vaccination clinics are taking a closer look at how they handle bad reactions to the COVID shot. Good evening. I'm Angela Taylor.
And I'm Rod Carter. Glad you could join us tonight. This comes after several people had to go to the hospital following a dose of the Johnson & Johnson vaccine that was at PNC Arena. Well, new tonight, we now know that Wake County is resuming using the J&J vaccine as early as Monday.
We have team coverage tonight, and we start with Jamise Price. Jamise, how are these clinics making changes?
Angela, they spent most of today going through their process on how they handle people who have a reaction to this vaccine. So they're really changing their workflow and addressing some of the procedures that they're doing. But I can tell you, from a UNC to here at PNC, these vaccine clinics were busy today with a steady flow of people coming in. And some of the clinics reported they did not have any cancellations. 2,200 people received vaccines at the UNC clinics over the last 2 days, but less than 10 people had a reaction to the Johnson & Johnson shot. Dr. David Wool, a professor of medicine at UNC, was there to help the patients who did have side effects like fainting.
Everyone that I've seen who fainted yesterday at the Friday Center told me they have a history of fainting around needles, whether it be a blood draw or a shot.
He attributes the reaction to younger people who are squeamish around needles and not the J&J vaccine itself.
And we have seen people fainting with Moderna and Pfizer. So I don't think there's anything inherent right now that we could point to in the J&J vaccine. But I do think we have to be more careful around people who have a history of fainting. So
they're changing things up a bit to better handle people who have reactions to the vaccine. They're working to identify people who have a history of fainting. And there's separate observation areas for those people with drinks and snacks.
If you're one of these people who say, you know what, that's me. When I get around needles, when I have blood drawn, I get queasy. Hydrate. We want you to make sure that you are drinking a lot before you get here so you have a good amount of blood in your system to keep everything flowing.
To get the new procedures in place, UNC did not give out the Johnson & Johnson vaccine today. There were 350 people scheduled to get it. Instead, they received the Moderna vaccine. And despite the brief break, health leaders here and the CDC make it clear the shot is safe, which was reassuring for people who showed up to get the vaccine. So tonight we gave you the number of people who had a bad reaction to this vaccine, which is relatively low here. You also heard from doctors who explained who is having a reaction to the vaccine, but there's still going to be some people who will not trust this vaccine. Coming up at 6, this is for you. The people who may not have confidence in the vaccine, doctors will explain why you should still trust science.